moving to next one, that is a 36-year-old woman present with ulceration over her finger. Ulceration over her fingers. She also has history of Raynaud phenomena and GERD since 3 years. Following can be used as a screening test. This is like a bit complicated question now. Try to understand this. First, you tell me what is the diagnosis. So if you see diagnosis of this disease, patients having GERD and Raynaud phenomena. So what's the condition where we can see Raynaud phenomena? When it comes to Raynaud phenomena, it could be like idiopathic, it could be cold climate, or it could be due to, I can say, emotional drive. Sometimes people can develop Raynaud, but here they have mentioned GERD for a reason. So there is a syndrome called CREST syndrome. CREST stands for calcinosis, Raynaud, esophageal dysmotility, esophageal dysmotility. That's why she is having GERD. Sclerodactyly means if you see these fingers are having these folds will be absent. Then what we have telangiectasia. So in this, I have two hints, means there is Raynaud phenomena, there is esophageal dysmotility that is leading to GERD. CREST syndrome is seen where we see this in scleroderma. So scleroderma, we have different type, like systemic form called systemic sclerosis. Then localized version is called CREST syndrome. So understand this CREST scleroderma, how we screen this. So now, even though you know the question, you know the diagnosis, still many of you are thinking to mark the answer. Like the antibody which is specific for CREST syndrome is anti-centromere. But they're not asking you specific, they're asking you antibody for screening. So mark my word, for screening, what antibody we have? We have ANA. I know, here you made a mistake. But this mistake should not be repeated in exam. So understand this, whenever we assume or a case of scleroderma, first test what you will do, we will do ANA. If ANA turned to be positive, then we check for specific antibody, and that is going to be, suppose if we are suspecting CREST syndrome, in that case it will be anti-centromere. If it is a systemic form, then we will check for anti-topoisomerase. This is for systemic sclerosis, again specific antibody. Anti-centromere, specific antibody for CREST syndrome. Anti-cardiolipin we see in APLA syndrome. So that is again for screening. Question is for screening. So screening, what we have ANA, remember. So ANA is screening test in rheumatology, very, very important. So then we think about specific antibody. Clear? So I hope the question is a bit clear. It was a bit complicated.